Hey, happy Global CE Day. We are so excited to have Keiko Fukuta, who's going to pronounce her name correctly for me. Welcome, Keiko.
Hi, Tom. I'm so glad to, celebrate CE Day with the people who are all over the world. I'm Keiko Fukuta I'm working in Japan.
So tell us about your roles in clinical engineering in recent years.
Okay, our license started about 30 years ago, and our responsibility is operate and the maintenance of medical equipment, especially life-saving machine, such as incubator, not incubator as well, but ventilator, incubator, anesthesia machine, and so on.
Yep. So what were your specific jobs, you're still young, but in the last few years, what have your jobs been?
Okay, thank you very much. You said I'm young, but I became a clinical engineer about 25 years ago.
Oh my
At
gosh.
that, yeah, at that
Oh,
time,
when you were 10 years old. Go ahead.
thank you. Okay, when I became a clinical engineer, our field working in the hospital is a just small area, blood dialysis department. But nowadays, it has been changing. Our responsibility already, I said, like for example, some of them is a perfusionist, some of them working in the operation theater, take care the anesthesia machine and so on. And some of them maintain the medical equipment. Some of them working in the respiratory, ventilator specialists. And so now our field is expanding in the hospital, and also our field of working area is academia, mystery, and so on. So it has
So
been changing very much.
So you were in, along the way, you were in hospitals, but you also worked with WHO very closely, and
Yes,
now the Ministry of Health?
yes, exactly. Nowadays, so already I mentioned our field of working place is expanding. So when I think about 10 years ago, I joined a volunteer work in Uganda as a clinical engineer. At that time, I noticed, clinical engineer job in the world is very important. So that's why I started in England to uh, study about policy and about policy and health management, healthcare management. So that by that time, I also have a chance to work in WHO under the Adriana. She inspired me because she's a hard worker, and also she gave me a lot of chance. So now I think my field is also expanding very much.
Well, tell us about your job now in the Ministry of Health in Japan.
Okay, I have been working in Ministry of Health nearly 5 years.
Wow.
First 2 years, I worked in the economy department, and my responsibility was medical device reimbursement. So that time, I was uh, I was enthusiastic to work about medical devices, but since 2 years ago, I work in the infection disease department. Like since last January, we are concentrated to work for measure, measurement of COVID-19.
Well, tell us more about that. So in the infectious disease part of Ministry of Health, it sounds like you got that assignment at the perfect time to make a difference in COVID.
Yes, yes. When we received the first time about the report of COVID was last, I think, end of December. Since that time, our department uh, tried to receive more information from China and also WHO and other international organizations. And the about 50th of January, we received a new suspected cases in Japan. Since that time, about our department usually about 40 people, but now it's about 200, more than 200 people involving against the COVID-19. Especially, I'm a clinical engineer, so first couple of months, my responsibility was antibody test and antigen test because at those time, we didn't know which, test is available and also profitable. Yeah. So that, a couple of months, I was concentrated to work at that, job as well.
Well, as you were saying before, Keiko, the Japan's clinical engineering has a little bit of a unique and a very strong model where about half their time they're operating high technology equipment as the super user, and half the time they're doing traditional HTM. How has JACE, the big national society of clinical engineering in Japan, been affected by COVID? And your, what, 25,000 members in JACE?
Okay, yeah, thank you very much. Yes, Jade now about 25,000 members joined, and Jade have a seminar, and also they made, I think, a monthly letter, and also they made a guidance for COVID-19 because most of the engineer working in the hospital and maintain a respiratory machine and so on. So first, I think Minister of Health and the other minister collaborate with Jay since early time because already, ministry know the, Jay, especially Japanese clinical engineer supported by Jay, uh, have knowledge about ventilator, and they think we are, professional and of infection disease against the ventilator. Yes, so I actually communicate with Jay about, I think, February, and they asked me, what can we do? And so I asked my supervisor, I received the, kind of, support from Jay, and they said, okay, we please do it, do this thing, this thing, this thing. So since that time, Jay and the minister collaborate very much, and I think that is a good thing to, make a smooth collaboration. Yes.
Well, Keiko, what a wonderful model. I mean, a great national society, a clinical engineer in the Ministry of Health, finding ways to work together, listening and collaborating with WHO. Japan is really ahead of so many other countries in how they do clinical engineering. What's your vision for the future of clinical engineering in Japan?
Okay, nowadays, compare with like a nurse and other, health professionals, our number of engineers is still uh, a few, maybe compare with nurse. Yes, compare with other country, we are 25,000 people became a member of J. So it is a huge, but compare with the nurse, number of nurse is still less, So we need to inform more people what we are doing, how important we are doing, especially, medical device nowadays, we are using a machine with AI and complicated things. So we definitely need a professional people who always keep on watching, keep make us safe. So still we, since we started our professional license, we keep uh, uh, we think medical device safety is the most important. So we would like to keep that, and also we would like to show people. What can I say? I think teamwork is also important thing. And nowadays, our reputation and our position is improving among a team. But we also would like to improve more because, we cannot work together without teamwork.
Well, Keiko, great vision, and thank you for joining us. I know it's late in Japan, even though it's early here, but actually we talked to our friends in Australia, and it was even later there. So anyway, I hope you have a good rest after a long day, and thank you for your time.
Thank you very much. See you
Okay.
soon.
All right. Bye.